to welcome Phil Chernin. And Phil is the president of our association, and he will provide a report to our members today. Phil is a longtime volunteer who has served in the past as director, treasurer, and over the past year, one of his many accomplishments has been in leading the effort to enhance our patient services program. So it's now my pleasure to turn it over to you, Phil.
Good afternoon, everybody. It is an honor for me to preside at what is our 38th annual meeting of the membership. So in the next 12 minutes or so, probably 15, I'll go over our history and mission, this year's accomplishments, the challenges we face in the coming year, and I'm going to be recognizing some of our incredible volunteers. In the beginning, our association was founded in 1983, incorporated in the state of Massachusetts in '85. It was a time when there was very little information available about the illness that we now know as ME/CFS. From mystery disease to chronic Epstein-Barr virus syndrome to yuppie flu, our volunteers shuttled books and articles back and forth to homebound patients on foot, by car, by US mail. There was no internet. Every article, VHS tape or news mention was a huge event. The heart of the association was our network of support groups, where people met in person to share stories, resources, and help one another cope. A program we now have moved to the internet. We enjoyed a warm collaboration with our guest speaker, who is arguably the nation's most celebrated ME/CFS medical hero. Dr. Komaroff provided yearly updates to our members at our annual conference. It was a time, believe it or not, where Dr. Komaroff could not find an audience of fellow physicians who were interested in what he had to say. Boy, have times changed. Back in the day, we were a lone voice in the wilderness. Now we're part of a much larger ecosystem of international organizations, clinicians, researchers, government agencies, authors, journalists, and we're all at the crossroads between the past decades of medical neglect, the present crisis of long COVID, and a future that we are all working to make greener and brighter for millions of individuals suffering with post-infectious and related chronic illnesses. We have found ourselves to be serving a unique role in this landscape, a role reflected in our mission statement here. We support people living with ME/CFS and their families by connecting them to supportive resources and each other, and by educating and advocating to expand the ME/CFS healthcare and social service infrastructure in Massachusetts. The phrase I'd like to highlight here is connecting them to supportive resources and each other. The support we provide is free. It's often deeply personal and confidential, and it makes a significant difference in the lives of hundreds of individuals each year. And you'll be seeing some quotes, I believe, and comments from people who have benefited over the last year. I'm happy to say that the association is in good shape. We've made good on all the commitments that we made at last year's meeting and much more. So let's have a look. We held 170 plus individual guidance and counseling sessions on disability determinations, health management approaches, and provider referrals. We added, I think, 12 to 14 healthcare providers to our referral database. We started support groups for young adults and seniors, and we held 18 open and free to all support group meetings attended by over 225 participants. We began a monthly applications of research discussion group that explores how current research can be used to guide an individual's discussions with their healthcare providers. This is regularly attended by 25 to 30 highly engaged patient researchers, and a big shout out to volunteer Sharon Simas for the amazing effort she puts in to prepare for and work with this group. And we began a evidence-based support group sessions facilitated by licensed mental health practitioners. including a special 6-part art therapy program, 8-part life skills program, and a 6-part coping with ME series. We launched our Sunday Conversation series of monthly online discussion forums featuring expert speakers on topics ranging from how to navigate the disability determination process to Chinese traditional medicine and lots in between. Programs in which over 800 individuals participated. I'll talk more about the group that put this on later. We held private meetings with the director of the Beth Israel Long COVID Clinic to share information about ME/CFS. And these talks resulted in a new section on our website of ME/CFS resources specifically for long COVID physicians. We were honored to be the recipients of proceeds from an art exhibit to increase awareness of the needs and talents of individuals with disability. Thank you, Linda Morgenstern, for that wonderful gesture. Center in conducting 2 grand rounds, one for ME/CFS and the other for fibromyalgia, and we made many enhancements to our various social media and communications outlets. Awareness building was a significant element of our educational programming. The figure on the left shows the growth in subscribership on each of our platforms. This past year, we increased total subscribers by more than 30% to nearly 10,000. It's 10,000 individual subscribers on each of our channels. On the right, we can see the reach that our campaigns garnered this past year. More than 75,000 users accessed our website. Over 25,000 users watched videos on our YouTube channel where this event will be published. I'll dwell here for a second so that you can take this in. Okay, moving on to advocacy. Total of 52 members and friends met with representatives from all 11 of the Massachusetts congressional delegation and the offices of both of our senators. Ron Beluso, one of our board members, spoke at the annual meeting of the National Organization of Social Security Claimants Representatives to describe the obstacles faced by individuals with ME/CFS and to establish a dialogue to improve claim processing. Hala Sluss, another board member, met with Congressman Raskin and McGovern to introduce them to researchers Lisa Sellen and Anna Gill. Their research at UMass Medical is well funded by NIH, thanks in part to a Ramsey Seed funding grant that they received years ago from the Solve ME/CFS initiative. This prize opportunity was skillfully orchestrated by volunteer Rivka Solomon. Other volunteers, Rebecca Redner and Jeannie Eisenstein, met with Congressman Jake Auchincloss to discuss issues affecting seniors and to hand deliver to them information about pending legislation we're asking the congressman to support. And we ran successful recruitment campaigns for ME/CFS researchers at both MGH Brigham and Tufts Med. And yes, there's more. A big shout out to the intrepid Mary Dimmock, who led a consortium of 7 advocacy organizations to get ME/CFS to be properly coded in the US version of IDC-10. And if we were in person, now's the time when everyone would jump up and shout and clap. Moving on to what is not nearly as glamorous. This year, we completed the transfer process for a large request from a past board member. Doing so enabled us to hire our first employee. In fact, we hired 2, an administrator and a patient services coordinator. And for those of you who have worked with either Ellen or Ken or both, I'm sure you will be surprised at their part-time job status. Truly, it seems they both work 2 full-time jobs. We also broadened representation on our board to include legal and research professionals. So we move to challenges. I'm sure the big challenges on the screen are familiar to everyone here. We need more ME/CFS literate clinicians. We need to leverage advances we have made in understanding ME/CFS to stem the tide of long COVID, and conversely, We need to ensure that ME/CFS patients benefit from advances made in understanding and treating long COVID. We need congressionally directed funding, and we need the general public to have a basic understanding of how severe this illness can be and to show compassion for those who suffer. And we're grateful for the work that the national organizations, our partners, are doing in these areas. As for us, our challenge is a bit more pedestrian. We need more members in order to continue to do our work. The more members we have, the more of a voice we have in our advocacy work. Size matters when dealing with politicians and the media. And since the bulk of our revenue comes from member dues and contributions, the stronger our balance sheet will be, and the more opportunity there will be for folks to learn about the different ways that they can volunteer and help our organization continue to serve those who are in need. While our stated mission is to improve the ME/CFS social and medical infrastructure in Massachusetts, we receive support and educational requests from throughout the United States and indeed the world, as evidenced by Karen's interesting opening slide. I think we have 28 countries, representatives from 28 countries who are in our newsletter database. As noted earlier, there appears to be no other patient-run nonprofit entity that provides the kind of free one-on-one support and guidance that we do, and so we really can't turn anyone away. As shown on the pie chart to the left, less than 35% of our subscribers are in Massachusetts. That's our newsletter subscribers. That's where we really have the most address information. We see the same percentage breakdown in our support group participation and in our website statistics. So our reach is broad, our work is vital, and with the advent of long COVID, the demands are compounding. We are good at the work we do, but we have not been very good at turning subscribers into members. We only have 361 members. Yes, that's not missing a zero. It's 361 members who support all the work that we do. To sustain the level of service that we provide and to grow our services to larger groups who seem to be coming, we'll need to double our membership next year, and we'll need to continue to add 300 to 400 members each year until we reach a very ambitious but achievable goal of 1,500 members at the end of 2025. And if any of you who are not members are inspired by what you hear and see today, you can start our campaign right now with a click of a link that somebody's going to put in the chat. Okay, I can't possibly thank all of our volunteers, but I do want to highlight three people who have just done extraordinary work this year. Firstly, Charlene Proskauer, who many of you know and has served in many roles with the association. And this year she focused on putting together the Sunday Conversation series, which has really been a fantastic program for us. Karen Dove, who is also on the Sunday Conversations group, not only does most of the moderating of our events because she's so good at it, but she also does direct patient service, guidance and counseling. And I'd also like to highlight Rebecca Redner with Andrea Jolet. Rebecca has just turned our social media world into a real healthy machine, and she does awesome artwork and has just wonderful sensibilities. So thank you to Rebecca. And lastly, I'd like to recognize a very special volunteer, Bonnie Gorman. Bonnie is the founder of our association. In 1983, after a severe acute viral infection that she thought to be related to her nursing service in Vietnam during the war, she set up the Massachusetts Epstein-Barr Virus Association, that is now us, to provide support, education, advocacy, and research. She worked actively with the association until 2003, when she had to step back after a motor vehicle accident. She's continued to work on our medical issues and committees since then. She's been a nurse and social worker for over 40 years and counting. She most recently has been volunteering at a COVID vaccine clinic and is closely following long COVID issues. It is to Bonnie that we give the honor of introducing Dr. Komaroff.